So fracture neck femur in patients with Parkinson's disease, this is a challenging situation. So let us discuss various treatment options, compare the treatment modalities. So as sir already said, Parkinson's disease is a neurodegenerative disorder which leads to progressive loss of motor functions due to loss of dopamine producing brain cells. And this is second most common neurodegenerative disorder. So this is, we saw this picture already. These are primary symptoms. So Parkinson's disease in elderly with neck of femur fracture. So there will be gait disturbances, instability, muscular rigidity, resting tremors, and bradykinesia. These are the abbreviations we will be using in next few minutes. So coming to the orthopedic challenges in fracture neck femur associated in patients with Parkinson's disease. There will be osteoporosis due to immobilization, reduced activity, vitamin D deficiency, gait disturbances, abnormal muscle tone around the hip, and altered forces exerted on the hip. Higher chances of implant failure, dislocation after total hip replacement, and bipolar hemiarthroplasty. Coming to the surgical challenge, the anatomy could be distorted, there may be poor bone stock, problems and leading to problems during femoral cut, during cementing and implantation of the implants. Leading to early implant failure, dislocation, higher incidence of dislocation and septic loosening following hip replacement procedures, owing primarily due to excessive muscle tone. There could be higher chances of periprosthetic fracture, higher mortality, higher post-operative complications. So treatment options, as sir just now discussed about his preference towards internal fixation in few selected cases. But I'll be inclined towards doing more of hemiarthroplasty and total hip arthroplasty in patients with displaced fracture neck femur. Some comparisons to clear the picture. So I would do fixation stable by saying stable I mean valgus impacted fractures or minimally displaced fractures, and replacement would be reserved for displaced fractures, unstable fractures, and patients with poor bone quality. Prospective randomized study of open reduction internal fixation versus cemented bipolar or total hip versus total hip arthroplasty. So the patients were ambulatory patients above the age of 60 years of age. There was as high as 37% of failures in fixation group. Failures like avascular necrosis and non-union. But the dislocation rate was similar when compared with hemi or total hip arthroplasty, that was 3%. Internal fixation had 8 times more likely to require revision surgery than hemi, and 5 times more likely than total hip arthroplasty. So this is the reason where I would go for a orthoplasty. Total hip arthroplasty group gave leads to best functional outcomes. So this is study group 1 patients of fracture neck femur with Parkinson's disease and another without Parkinson's disease. So group A had greater risk of post-operative dislocation in group A, greater risk of revision surgery for instability within 90 days of surgery. But there was no difference in risk of death or any post-operative complication in both the groups. Total hip arthroplasty in fracture neck femur in patients with and without Parkinson's disease. Group A did not experience increased mortality in the immediate post-operative period. However, long-term follow-up data showed a higher mortality risk likely attributed to the disease progression itself. Group A patients were at a higher risk of revision, dislocation, and periprosthetic fracture following total hip arthroplasty. But there was improved functional outcomes were noted in Parkinson's disease patients undergoing total hip arthroplasty. Total hip orthoplasty did not result in an increased risk of death in early postoperative period. Given the fact that Parkinson's disease is a progressive disorder, primary total hip, but unfortunately this got infected, a 2-stage revision was done for him. So in summary, geriatric fracture neck femur, close reduction internal fixation can be reserved for valgus impacted or non-displaced fracture. Arthroplasty if fracture is displaced. Consider total hip arthroplasty for active older patients. Thank you.